I'm gonna make a change that might save my life. It's gonna feel real smooth with a couple wrinkles if I do it right. 'Cause I know that this cancer can afflict a younger man who doesn't follow this rule. If there's cold in your sack, better watch your back. Don't be a fool, your precious jewels are probably about to get hijacked. You got to realize it could metastasize if you wait too long. It happened to biking legend Lance Armstrong. You think your stones are safe, but you're wrong. That's why I reach in my phone and I'm checking out my nets in the mirror. I'll feel my junk for lumps and stuff. 'Cause no doctor's gonna be half as thorough. If you wanna stop cancer off the nuts, you better feel up your scrote. No ifs, ands, or buts. Oh, na 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 na. Hee 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 na 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 na.
Ooh, that gives me a little PTSD just looking at it. Let's see. I'm going to talk about Hannah. So when we go into medicine, don't we feel like this? I'm looking at medical students here and thinking, I'm going to change the world. I'm here to help people. I'm going to make a difference. And then somewhere, maybe it's medical school on a bad rotation, maybe it's your residency training, maybe it's your first job where you realize you're working in a horribly dysfunctional and broken system and you've despaired. But you look in the mirror and the reflection has changed. I actually was able to obtain a post-concert radiograph from this. I'm sorry, do they not have right prosthetic hips in Ireland? Take that, Mary Ennis O'Connor and your gorilla. See if you can spot the elephant in the rectum here. Actually, you know what's it? You could imagine what the radiographer's read of this, radiologist's read would have been, right? Is that, yes, there's a well-seated right prosthetic hip with surrounding osteopenia. There's a normal bowel gas pattern. No evidence of fractures. Incidentally noted is an oblong ground glass opacity, shape consistent with Coke, cannot rule out Pepsi. Suggest clinical correlation. But today, what I want to talk about a little bit is about the elephant in the rectum of healthcare. And that's our culture and why we do what we do and how we find the meaning in our lives and how we can translate that into much better patient care and a better health system in general. And it always starts with a story. And I know that Mark Triola talked about 23andMe earlier, this genetic testing where you spit in a cup, they run your DNA. And for $99, they'll tell your ancestry and all of that. And I did this a few months ago, trying to learn a little bit more about who I was, looking for my identity. And what I learned actually was shocking. And I still get kind of emotional thinking about it, because I found out that the person who all my life told me he was my father, raised me as my dad, was a father to me. It turned out he was my actual father. How could it be? We look nothing alike. And so, he's an internist, a general practitioner. My mom's a psychiatrist, by the way, which explains pretty much all of this. But, he was a foreign medical graduate from India, came to the US, $10 in his pocket. And all my life growing up, I did not want to be anything like my parents. I was not going to do medicine. In fact, I loved music. I wanted to be a musician. I loved comedy. I wanted to do comedy. I basically wanted to be Weird Al. Unfortunately, I had none of the talent that Weird Al had, and I had immigrant Indian physician parents. Now, those of us with immigrant parents know that the expectations, it's like being named Jeeves. You're going to be a butler. Having immigrant parents, you know the expectations are high. And so, like it or not, I was heading in a direction. And the truth is, when I shadowed my dad in his clinic, in his primary practice clinic in the Central Valley of California, rural California, I saw something amazing. I saw a man who did not train with MRIs and CT scanners and labs. He trained with touch and intuition and that insight that comes from hearing a patient and being with them together. And I remember I sat and I started to really fall in love with the art and practice of medicine. He would let me shadow. And one time there was a gentleman with right upper quadrant pain. And I told my dad, hey, well, let's get an ultrasound. And my dad goes, ultrasound. No wonder these idiot Americans are spending the 2.8 trillion on the healthcare and getting the worst outcomes in the developed nation. They are not listening to the patient. And I said, okay, this is going to be good. He goes up to the patient's belly with his fingers, and he starts percussing. But it's nothing like you've ever seen. He's like, tuk, 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 tuk. There is a 3 millimeter thickening of the gallbladder wall, tuk, 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 with a tuk, 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 percusso-dense 2 centimeter gallstone, tuk, 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 located in the neck of the gallbladder. Tuk, 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 tuk. There is trace pericholecystic fluid. Suggests clinical correlation. I was like, that is the dopest thing I've ever seen. I want to be a primary care physician like you. To which he replied, you're the dopest thing I've ever seen. Do not do primary care. What I do is dying away. These bastards. Whenever my dad says, these bastards, it usually means insurance companies, the healthcare system, etc. These bastards, they don't pay you to think. They don't pay you to develop relationship with the patient. They don't pay you to care or to listen or to dig into what is really paining the patient. They are paying you not to do things for people. They are paying you to do things to people. Especially to the rectum. Babu, there are 5,000 rupees in everybody's colon. Just go with the scope and fish it out. Do GI. And I said, but he goes, you know your Uncle Bhupinder, all day he's a GI. All day he is spending playing video games inside people's buttocks. Do you know what he's driving? Lexus. All day I'm spending talking to patients, hearing their story, feeling the pain that they are feeling. What am I driving? Toyota Camry. Fabric interior. I said, Dad, the Camry is actually a much more sensible version of the Lexus. Shut up and don't talk back. Go and be a specialist. And with that, I went to medical school. And there were days when medical school felt a bit like this. It's amazing, medical school. It's magical, and at the same time, it's just horrifying the way we trained doctors and kind of continue to train them. We have these fake patients, the simulated patients, the actors, which in my day, the acting wasn't very good. And so what happens when you go into medical school with a high degree of empathy, like many of us do, and you're told, talk to this patient, figure out what's going on, and report back to the attending. Well, every single time, I would come out of those interactions, hands in my pocket, and they'd say, what's the diagnosis? And I would say, easy, malingering. Unfortunately, that was not the diagnosis. It was whatever the patient was pretending to have. But I happened to catch on that the patient was pretending to have something, right? And then there was this time in my medical rotation where this was a crucial rotation. We had got pass-fail honors. Only 1 out of 4 students got to get honors. And if you didn't get honors, you didn't get that residency of your choice at a good school in California, blah, 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 blah. So I was there in my short white coat, and there was a wonderful hierarchy, and the whole big team was there. And I had an attending physician. Since we're in Ireland, for the purposes of this talk, we'll call him Flanders. That was also his actual name. And I no longer care. And he said in the beginning of the rotation, there are no stupid questions. Flanders was a liar, because apparently I asked such a question, to which he replied in front of the entire team in the ICU, Damania, you speak and then think. I would like you to reverse that, or better yet, just think. And I remember feeling like the bottom of my world had dropped out, and my career was over. And all because I just asked, if essential hypertension is so essential, why do we treat it? And I remember the pharmacy resident came up to me afterwards, and she put her hand on my shoulder because I was clearly devastated. And she looked in my eyes, and I thought, this is what it's about. It's about us coming together and supporting each other in this very difficult training process. She looked in my eyes and she said, I think Flanders hates you. Literally. So for 2 more weeks, I go on rotation, and then I get called into Flanders' office for my evaluation. And he sits down and he just exhales. Where to begin? And I thought, dental school? Because this is not looking good. He said, Damania, you don't respect the fact that there's a hierarchy in medicine. You have a short white coat, I have a long white coat. You're making jokes on rounds, you're talking like you're a resident or an attending. You clearly are not having a miserable time, and this sort of attitude is going to hurt you in the rest of your training, because that's not how we train physicians. There are rules, and there's a hierarchy, and it's going to hurt you, and it's hurt you on this rotation. And you know that look you get when someone's breaking up with you and you're trying not to cry? I had that. It was like, tell me more. But I didn't. I wasn't going to do it. I wasn't going to break. And then he said, but I talked to your team, who said that the way you made them feel on rounds was that everybody was equal and they were all part of this bigger picture. And the way you made jokes made everyone sort of more comfortable, because humor is sort of holding paradox and pointing it out. And they said, then I talked to the nurses and the clerk at the front desk and the person who brought the food, and they actually volunteered that you made them all feel like they were the most important people in the hospital for the care of the patient. And then I talked to the patients, and they said that when you were in the room, they felt like they were the only person in the universe that existed in that moment, and they felt heard. And that was an exception to their experience in the hospital, where people were rushing around. And he said, you clearly understand what it means to be a good doctor. Your problem is you're trying to cut to the chase. You're not playing and learning the rules so later on you can break them. And you're using humor to put people at ease, but a lot of people in authority aren't going to like that. It's going to feel threatening. So my advice to you is learn the rules, later on go back and break them. And so despite my better judgment, I'm forced to give you honors in this rotation. And at that point, a tear did start to kind of come down. I couldn't believe it. And then I sucked it back up, because I wasn't about to lose my street credibility that easily. Because if I did, then I'd have to kill a man to get it back, and I was not going back to jail. But I had hope for the first time that, okay, I'm going to listen to Flanders. I'm going to do this. And then I finished my training and long stories. And then I realized when I got into practice, about year 8 into practice, that my patients started to look like this in our Western healthcare system. Mr. Pooh, presents to your clinic? What do kids see? We see an adorable figure who loves honey. What do I see? I see an anxious, affected gentleman with a very concerned affect, a black nose concerning for possible cocaine-related necrosis. Likely anxiety disorder not otherwise specified. There is a central obesity concerning for early metabolic syndrome with insulin resistance, confirmed by the complete absence of fingers and toes, concerning for diabetic polyneuropathy with autoamputation. Despite his name, he hasn't. Concerning for diabetic gastroparesis with severe constipation. And despite this litany of disease, as I see it, Mr. Pooh's auto-amputated right paw is still in the honey jar. And so what do I do? Do I have time in my 10-minute visit to investigate what hole in Mr. Pooh's life that honey is filling? Is there caregiver burnout because he's taking care of Piglet? Where is Christopher Robin? He's completely AWOL. I don't have time for that. What I have time to do is go, okay, Mr. Pooh, you've got diabetes, you should walk it off, you should check your blood sugars 3 times a day, here's 5 different medications, here's 12 different tests, here's 7 different specialists, and I'm gonna get you admitted to the hospital because you still have a little bit of dangling black necrotic toe on the left that needs to be amputated by a surgeon, and I send him out. And Mr. Pooh comes back, of course, a month later. Despite losing a toe, he's heavier. He's not taking any of his medications. And his hand is still in the honey jar. We haven't done anything. It's a revolving wheel. It's a sick care system. And nobody's looking at the bigger picture. Nobody has time or incentive. I'm not getting paid to look at the community that surrounds him, or the fact that maybe honey should be back in trees guarded by bees, as God intended, instead of in every single store in the cheapest possible way in our poorest areas. And don't even get me started on Eeyore. I don't even know how you get a scar like that. And so 10 years of this as a hospitalist at Stanford, where I was looking at 50% of the patients in the hospital didn't need to be there if they just had someone to look at the big picture, if there was a focus on prevention, someone to hear them. We were wasting money and lives. And in this context, my daughter one day digs into my bag, grabs my stethoscope, and comes to me like this. And immediately I'm like, oh my God, that thing is covered with bacteria. And she says, Daddy, when I grow up, I want to be a doctor like you so I can heal people. And my first instinct was to ground her and tell her, what are you thinking? Can you believe it? And instead I said, you know what, I'm a progressive individual. I'm going to show her by example what it's like, and she can decide for herself. And I would have taken her to the hospital, except I would be afraid she'd come back with Clostridium difficile. So instead I walked her through it. I said, okay, let's go through a day of mine. It begins at 4 a.m. There's no SpongeBob, there's no Dora. There's just 40 voicemails signing out sick, complicated patients with millions of things to do. And after you're done with that, you're going to walk into the hospital where you proceed to do a U-turn at the foot of the bed of people who are having the worst day of their lives, who are sick, scared, sometimes dying, with their families, and you can't give them more than a 5-minute U-turn at the bed. Why? Because you've got to go out and then spend 5 hours with an electronic health record, which Mark mentioned, the name is Epic. It isn't, which is nothing but a glorified billing platform that has turned the beautiful narrative of our patients' notes, of our patients' stories, into a cut and paste ransom note. And it's 2 keystrokes away from becoming sentient and destroying humanity. And then I go back to the voicemails, and there are 40 more voicemails, all from administrators asking me to do more and more with less and less, while improving patient satisfaction, which by now to me it's clear is an oxymoron. And I get to voicemail 41, and I'm like, I gotta delete this, and it won't delete. And the voicemail's getting louder, and it still won't delete. Now I have to call IT, and some non-doctor is going to yell at me about how to delete this. It's going to take another 10 minutes. And then I realize this message is getting more anxious and more upset. And then I realize the reason it won't delete is it's a live person. And they called me, and it's my wife. And she's asking when I'm going to be home. And when I finally get home, little girl, I can't spend 5 minutes truly being present with the most important person in the world with me, because all I can think about is, in this insane shuffle of a day, did I miss something that's going to injure or kill another human being, devastating me for the rest of my life? Lather, rinse, repeat for an entire career. Is that what you want to do, little girl? And she hesitated. And I said, actually, I also have a PowerPoint for you. And after reviewing this PowerPoint, she took a breath and said, Daddy, I think I'll just be a princess instead. How is it that I was back here? I'd paid my dues. Like 60% of American physicians, I couldn't recommend the career to my child. Like another 60%, I would retire that day if I could. What is the saying about what should be a sacred calling, right? It was ridiculous. And what was happening is I was teaching on the wards at Stanford, and I was winning teaching awards. Why? Not because I could teach, but because I reflected back to the residents this bitterness and this culture. I spoke truth. I was the fat man from House of God. And they loved it, and they gave me teaching awards. And the problem was this poisonous culture was poisoning me, and I was in turn poisoning the next generation. If we had a difficult patient that was a frequent flyer in the ER and kept coming back, I actually had these made and would give them to the house staff, only half joking that they should pass them out. It was terrible. And then I would look at this next generation, these millennials, and I would see this hope and this optimism. And I would think, you guys are deluded, because it's only getting worse. And like so many other doctors, I would tell the next generation, you know, this is a bad idea. And it was horrible. And the thing is, by the way, millennials, things have changed so much on the wards. Have you noticed these kids? They're all wired up, tweeting each other. Here's the thing. These abbreviations that they use show up in the chart. I actually saw this in a chart. It's absurd, right? It's absolutely ridiculous. Because we all know that you can't use these type of abbreviations in a chart. You always spell out gastrointestinal. I mean, really, people. And the worst thing is, if I tried to use technology, I would get in trouble. So, you know, Kevin Barry had a great piece about how he was checking his Hotmail, his email all the time. I once almost lost my privileges at Stanford for checking my Hotmail account at work. I didn't understand it at all. Like Kevin, I would check this compulsively, 150 times a day. And so after my daughter came to me, I actually had this almost breakdown where I realized what was happening here, that I was so burned out. And what I realized too is that as a person, I was living somebody else's life. I was this cog in this broken machine, and I had all these aspirations when I was young, and here I was just going through the motions. I could have been replaced by anyone, and it would have been no different. And when you live that kind of life, this long shadow starts to get created, and that shadow starts to cause trouble. And I started having these intrusive thoughts and these sort of compulsions, and they got louder and louder, and I got very depressed. And one day, I just decided I had hit bottom, and I was going to act on one of these intrusive thoughts. And I did the only thing that I thought was available to me at that time. I created a rapping alter ego and started making parody videos about medical topics and putting them on YouTube. And yeah, I know, rock bottom, people. Like, really rock bottom. And I called it ZDogg MD because I couldn't think of a name. And I put 2 G's because it's way more gangster than just 1 G. And I threw very ambivalent gang signs, you know, like West Side or East Side, it's cool, whatever you like. And I did videos. I realized this actually made sense at the time because I looked at the Latin word for doctor. It's docere, which means to teach. And here I was in a career where I couldn't teach. We didn't have the time, we didn't have the incentive. Now here was my chance to teach in a way that might engage patients. So we did that Manhood in the Mirror video with much personal cost to my own manhood. And I started getting emails from student health clinics around the US saying, you know, that is a ridiculous video. We play it in our lobby, and young guys actually go home and they're like, that was a stupid video, and then they actually do the exam. And a couple of kids caught early testicular cancers just because they saw this video, it popped in their head, and they did it. And I thought, a doctor in his bathrobe with a handy camera on a tripod and a Mac can actually save lives and prevent disease in a way I felt I was powerless to do in one of the top academic centers in the country of the United States. That is absurd. And then it got out of hand. We made about 70 videos, and we had a blast. We did one. We realized hands-only CPR was the thing, and they were getting rid of mouth-to-mouth. And I thought, oh, it's interesting because there's an Usher song, Yeah? Have you guys heard that? It turns out, you might recognize it if I do a couple bars, but it turns out that the metronomic beat is exactly 100 beats per minute, which is exactly the rate of chest compressions. So it was like, clear. Look out, mouth to mouth's ridiculous. In the club when the mouth's vesiculous. And yo, your protocol's all out of date. Blowing air down the pipe is so 2008. So forget about that. I'ma squeeze the chest. CPR hands only when your homie arrests. So we did something like that. Ludicrous, really. Literally. And I felt awakened for the first time. I was doing my 80-hour-a-week day hospitalist job and then going home at night and doing this. And I'd never felt so me in my life. I could combine all these best aspects. And then I found myself wishing, like, well, oh, by the way, I heard about Garthgate. So it's funny. So we did a Garth Brooks song, Friends with Low Platelets. And it went something like, blame it all on my labs, these bruises and scabs. Is it normal to bleed when I floss? I was the last one to know what the CBC showed. Why does my stool look like barbecue sauce? And it's funny, we did that one. And I thought, you know, hopefully it doesn't offend anyone with low platelets. I got emails from mothers of kids with ITP whose kids were playing it on repeat because they now could resonate with something that was uniquely about them, whereas before their illness had isolated them. Now they had something to go to school and show their friends. Look, this is what I have. I have what this jackass is talking about. And it was amazing. And so I started wishing to myself, imagine if we had a more conscious operating system in medicine where this kind of scenario where doctors could bring their unique gifts to the table, where we could meet patients where they are, where we could hear their stories and celebrate them. What if that actually existed? Now, sometimes when you start living the life that you were probably supposed to live and you wish hard enough, a fairy godmother will come down and sprinkle you with fairy dust and give you your wish. In the real world, sometimes that fairy godmother looks like this. Do you guys know the company Zappos? It's not in Ireland, but they're a subsidiary now of Amazon, which we all do know. This is Tony Hsieh. He's the CEO of Zappos. They sell shoes online at a time when it was considered ridiculous to sell shoes online because you can't try them on. He built the company in 1999, starting out, on the premise that if you get the culture right, if you get the customer interaction right, the rest of the thing will fall into place. And it did. to the tune of a $1.2 billion sale to Amazon in 2008. He had seen my videos. He knew my wife from school, and he pinged me. He reached out one day, and I picked it up, and I thought, oh, a billionaire's calling me. That's exciting. I won't let that go to voicemail. I'll take that. And he said, look, I've been watching your videos, especially that Michael Jackson thing, way creepy, but also kind of interesting because you're clearly not in your right mind. As a physician, you're probably the right person to talk to about what we're doing in Las Vegas. You see, he had built Zappos in San Francisco, moved it to Las Vegas because he found people in Las Vegas cared about hospitality and customer service in a way that people in San Francisco did not. And he had sold the company to Amazon, but he stayed on as CEO because he felt he had more to do. And what he had to do is he had been studying cities. And what he realized is as a city doubles in size, it becomes 15% more productive per capita. When a company doubles in size, it becomes less productive per capita. Why is that? Well, it turns out in cities, you get a bunch of people in close, dense urban proximity, and they bounce off each other in serendipitous ways. So innovation springs when an architect meets an engineer, meets a musician. A new company is born. And no one tells them what to do. It's organic. It's those serendipitous collisions that create innovation. In companies, there's a boss and a hierarchy and a very Flanderian kind of world, right? So things get more calcific as the organization grew. Now, he knew Zappos needed to grow. So he said, hey, how about this? How about we take Zappos and move it from the suburbs of Las Vegas, where it's walled off in an isolated building, and we plop it in the heart of downtown Las Vegas. Now, people around the world know Las Vegas as our strip, this sort of mirage of craziness. Siegfried and Roy and blah, right? What happens there apparently stays there and should. This is different. This is 4 miles north. This is the heart of the old Las Vegas, Frank Sinatra. It had fallen into decay, drug abuse, empty lots. But there was a resurgence in these quirky bars and pubs and cafes and a burgeoning sense of culture for a city of 2.5 million people that had no identity beyond this mirage of a strip that was one flight away from anywhere in the country and had 43 million visitors but felt like a small town. And so he said, what if we put Zappos in the heart of this, and I spend $350 million of the money I got selling the company to Amazon, and curated and tried to accelerate the development of the city around Zappos so that we could see this serendipitous collision rate increase. And you couldn't tell where the city began and Zappos ended. Wouldn't it be interesting to see how Zappos did in that world? So 50 million for the arts, 50 million for education, 100 million for tech startups. And he showed me Container Park, which was a Motel 6 frequented by drug users. Kids would never be there. It's now a series of shipping containers that serve as incubation vessels for small businesses. If they succeed, they move on to permanent quarters. If they fail, just rotate another business. And there's a play area, and now there are children in the heart of the city where there were never any before. And I said, why are you telling me this? And he said, because there's 20% of the US GDP that we haven't accounted for in this, and we don't understand it because we're logical. It's called healthcare. How about this? Quit your job at Stanford, move your wife, who's a radiologist, to Stanford, and your 2 little girls to the heart of downtown Las Vegas. I'll give you a little startup money and figure out how you can fix healthcare. And so I was like, hold please. I get on the Google, and I Google healthcare in Las Vegas and innovation. And I found this. I know in Ireland, you guys are like, what's a hangover? That's just life. And I thought, well, this is a little scary. And then I saw the real statistics. Almost worst in the nation for ratio of primary care physicians to patients. Worst in the nation for preventative measures like vaccination, et cetera. Appalachia level outcomes. Horrible, horrible. And I thought, great, this will be easy. And so I called my dad, like I always do when I'm scared. I said, Dad, what should I do? And he said, wait just a minute. This bastard wants you to move to the desert to sell shoes for the Japos. I said, no, that's in fact not what I said. Wait, hold on. Do you think I could get an employee discount? And I said, I might be able to swing that. Get a hepatitis shot and go. You are miserable, okay? Now's your chance to prove to me that you're not just whining. Go try to do something. And if you screw it up, come crawling back and I'll give you nothing. And so when I told my family that we were leaving the beautiful Bay Area and our house on the hill and my 401k to move to downtown Las Vegas to try to fix healthcare, they were really supportive. And when I told my oldest daughter that she was going to have to give up most of her toys because we were moving into a small condominium, she promised me to use her imagination. But we did it. And here's my daughter in downtown Las Vegas. And she's pointing at someone shortly after. She said, "Daddy, why is that woman wearing hardly any clothes?" And I said, you're so naive. That's not a woman. By the way, do you see my shout out to Ireland? Fitzgerald's. I understand all of you have a leprechaun and a pot of gold and all that. That's apparently how Las Vegas sees Ireland. So what was interesting is for the first time in my life, I was able to unplug from the sort of treadmill because I realized something. Flanders had told me, play by the rules, then break them. I listened to part A, and I totally forgot about part B. And that was probably the source of so much personal suffering. And I realized, wow, when you're in the system, you can't see the system. You have to unplug from the matrix to see the zeros and ones that exist. And in the US, this is what I saw when I unplugged. And you know, and the truth is, anyone who can do math can realize that this doesn't add up to 100. I actually found the missing 1%. I have no evidence of this, but it just feels right, doesn't it? So we don't prevent, in Ireland that green is much bigger, I know. But in the US it's backwards. Too many specialists, too many consultants, not enough GPs. And I said, okay, how about this? We're spending 4%. This is Vegas. Let's double down on primary care or triple down. And let's really spend properly on prevention, and then let's change everything. And the result of that was this. Turntable Health, the clinic we built in the heart of downtown Las Vegas. This is our team. And the way it works is this. We said, okay, my dad pointed out clearly that the US healthcare system, which is fee-for-service based, pays you to do things to people instead of for people. Well, hey, what if we make it a membership model, like a gym, where for a flat fee, you get all you can treat access to the buffet. And that then takes away all that negative incentive to do more. And the truth is, the government, individuals, businesses, all of them can pay the fees on behalf of the patients. So it's very different than concierge, where you're charging a patient a ridiculous amount of money to have access to a doctor whose sole goal is to keep them happy by giving them whatever they want and ordering whatever they want. Instead, the goal is to keep them healthy because we're accountable to the business, to the individual, to ourselves. It's very different. And by doing that, we open up the care model for innovation. So now, Andrew here with the tattoo of his daughter is a unique player in this game. He's a health coach. Earlier in the day, during the panel, someone asked, how do we in a 10-minute visit listen to our patients, hear them, be present for them? It's impossible to do. But it's really not, because we talked about it. Well, if you leverage the fact that probably 60% of what we do in a GP's office can be done by someone without a medical degree, but who has a little something we call empathy, you can then empower the physicians to operate at the top of their licenses, and the patients get an amazing experience where they're heard and their story is unfolded. Andrew is a paramedic in nursing school. He is also a bartender at the Wynn Resort. We screened 500 people to find 2 health coaches based on empathy. their ability to get stories out of people. And they are sort of entry level. There are 4 of them to every doctor. And they can room a patient for 30-minute minimum visits, which is our minimum visit length. And the doctor can go from room to room, really coordinating and connecting. And they don't have to do the heavy lifting and the blocking and tackling that isn't in our sort of medical space. And so this is incredibly empowering as a medical model. The second thing that it does, it allows a team-based approach. So you have the health coaches, then you have Nina, who's our licensed clinical social worker, who in the US does mental health. And so she is able to dig into the real root cause of so much illness and suffering. And it also happens that she's a yoga and meditation instructor. And it also happens that we built a yoga and meditation studio in our clinic. And so she can identify people who are the most anxious, who are the most likely to benefit from this, and then teach the classes. And they're all included in the membership, unlimited. That is interesting. And she can go back to the doctor who's across the hall and say, such and such really benefited from this. One of the things I noticed was this. It's very integrative. And if you look at the design of our facility, this was an early rendering of just the concept. This idea that you engage the community, the entire 100-acre woods, as it were, and you bring them in and you welcome them into a place that does not feel like a place for the sick, but a place for people who want to be well, who are welcome even when they are well, so they can stay that way. But the most important part of the model is here, the doctor and the patient in this sacred space that, if you'll notice, has no pokey stuff. And if you'll notice the electronic health record, which we built from scratch because all the other ones were rubbish, we built it from scratch to be read by patients, to be written in by patients, to be a narrative unfolding, to do population health on the back end, to identify people who we assign a worry score, who we're scared will get admitted in the next month, who we can proactively reach out to during the huddle when the whole team comes together to talk about not the patients who are coming in that day, but the patients who aren't, who we're concerned about. In this sacred space is where the next evolution, I think, of healthcare should be. This conference is called dotMed. Let me go through a couple of dots in our medical pantheon. Health 1.0, the 20th century, our cottage industry with an autonomous physician and a patient, no regulation, no quality measures, but a sacredness, although patriarchal relationship. Very similar to the single pilot ancient airplane that Mark Triola showed us earlier. Wonderful as far as it went, but what did it do? Almost bankrupt our economy. Quality was horrible. Patients felt a little disempowered. So what was the response to that? Health 2.0, which Mark also described very well. Informatics, systems thinking, quality measures, productivity measures, a lot of administrators to manage all of this. National health systems, excellent as far as it goes. With every excellence, light is cast. And with it, an equal amount of shadow. What's the shadow in Health 2.0? A commoditization of doctors and patients alike. We all feel miserable. We don't have time. We can't connect. We're bound by these guidelines we have to check off that don't talk to that patient who's in front of us, that unique soul in front of us. We have to please the bean counters. And that's why doctors feel this nostalgia for 1.0. which we shouldn't be nostalgic for. Well, so what is this? I propose that this is Health 3.0. This is the next evolution of healthcare. It includes, but transcends, both 1 and 2. We return to the sacred doctor-patient relationship. Instead of patriarchal, they are now 2 equals, sharing a dyad, sharing decisions, sharing stories, holding each other accountable. The doctor is evidence-informed, but not enslaved. The patient is held accountable to release that victimhoodness, that exclusive identification with illness that is so damaging. And they are both made better by the experience. Notice how they're sitting next to each other in a triangle with the record. This was conscious. And it takes time, and it takes support, and it takes a team to fly a space shuttle. It takes Health 2.0 to power us to be able to get to this point. And so now when you look at the 100-acre woods, the whole community benefits from this focus on prevention and wellness. And that's what we're trying to do. Now, people ask me, why did you call it Turntable Health? That's pretty flippant. Is it because of the ZDogg thing, you're trying to be a gangster? Is it because every single person in Las Vegas, apart from their day job, is in fact a DJ? Which is true. Oh, you're CEO of the largest hospital in town. Yeah, but I spin at the Wynn at night. All true. The reason we called it Turntable is those of us old enough to remember vinyl, and those of us young enough to have rediscovered vinyl, know that there's a sacredness to the ritual of taking an analog disc that has album art on it, that has 14 tracks that tell a beautiful, cohesive story, that you put on a platter and you lower the tone arm and you're with your friends and you pay attention together. That warm analog sound, that's the beating heart of medicine, isn't it? Isn't that why we were Hannah Montana dreaming of being doctors? What is healthcare so much like today? An MP3 player with a crappily compressed file of zeros and ones that you've stolen from the internet that blare into earbuds while you're on a bus, disconnected from the rest of your fellow human beings. That's what it feels like, doesn't it? So we wanted to bring it back to the old school, if you will. And so now, to wrap it up, if my daughter were to come to me now and say, I want to be a doctor, I can tell her I've never been so excited about the future of healthcare as I have been today. That the next sort of conscious operating system of Health 3.0 is just around the horizon. If it isn't Turntable, it's something else. But it's going to take everybody here, physicians to rise up to demand it, and patients to rise up to demand it. And so, little girl, you are going to have the privilege of every day having intimate interactions with people, sharing stories, so that this wave of positivity spreads out through the community, transforming countless lives every single day, including your own. What a gift it is to be a healer. Unfortunately, since living in Las Vegas, she now may have different career plans. I'm going to stop talking right now because I know we've had a long day. But I do have a quick something potentially, if I can pull this off, which I can't guarantee that I can. Let's see. Oh, very nice. So Sam Jackson, who's actually a real brilliant musician, is about to be embarrassed by a fake, not brilliant musician, trying to sing one of our later songs, clearing up a little bit of the hysteria around a certain something that's been going around the world lately. Let's see if we can pull this off. We got sound? All right. You guys may recognize this song. I can't play guitar, by the way. I hope you know this. This is the only second time I've performed live in my life, so let's do it. I caught it in a town in West Africa where the state of public health isn't what it was in Pensacola. C-O-L-A-Cola. She walked up to me and I asked her what's up. She looked kinda hot and in a raspy voice she said Ebola. Ebo-bo-bo-bo-la. Ebo-bo-bo-bo-la. Well, I'm not the world's most sensitive guy. Pretty clearly, right? But I'm not sure it's normal when you bleed from your eyes. What's Ebola? Ebo-bo-bo-bo-la. We danced all night and I kissed her goodbye. Then I hopped a plane to Dallas, took the red eye. With Ebola, Ebo-bo-bo-bo-la, Ebo-bo-bo-bo-la. Well, I've been back about a week or more, and I never had this high a fever before. But the ER doc heard my complaint and said, it's a virus, here's a Z-Pack, now go back home to bed. Now, I'm not a doc, but I can't understand how I can come from Liberia and not get scanned for Ebola. 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 High fever today. Jet lag, people. It will kill you. It's like 17 in the morning right now. High fever today. Abdominal pain. It hurts in my brain. Is that blood in my pee? Who's that at the door? The CDC? I hope so. They said, no, those losers only try to confuse, so we'll handle this from here. We're the guys from Fox News. It's Ebola. We repeat, it's Ebola. Saliva, sweat, vomit, blood, and poo is the cause, but let's just blame Obama and trust Dr. Oz about Ebola. 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 Well, it's ZDogg here to help us out of this mess with a song that ought to go viral, I guess. While Ebola's bad, let's not forget the score. C. diff, staph, and flu already kill way more. But that don't make for compelling TV, so let's make the same mistake we made with HIV. This time Ebola. Ebola. Everybody now. Nobody now. Ebola. Thank you very much. Thank you very much.